Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. June marks the month of National Cancer Survivor Month. Yesterday, in fact, was recognized as National Cancer Survivor Day. I happen to have passed my 37th one of those, marking me as a 37-year cancer survivor at this point. The NCIS recognizes cancer survivorship from the moment that a person gets diagnosed with cancer. It's not necessarily tied to when you complete your treatments, which is actually what I do recognize my survivorship anniversaries officially by. But for purposes of argument, you're a cancer survivor from the time that you're diagnosed. So, one of the questions that I'd like to deal with for National Cancer Survivor Month is a question that gets asked a lot of time, and that is, when does life get back to normal? Okay, we all remember what that time was like, and trust me, 37 years ago, I can remember what my life was like normal back then. But we have to ask ourselves, what exactly does normal mean? What are we looking for when we get done with our treatments and we make the comment, when does life get back to normal? And why are we asking that? What is it about having completed our treatment that our life doesn't feel normal yet? Is it because we're not doing the things that we once were able to do? Or is it because we're done with our treatments and we still have to see doctor appointments yet? Well, in the cancer circle, many of us survivors will tell you that when we talk about normal after treatments, we're telling you to prepare yourself for a new normal. And a new normal is going to be whatever you make it. Now, if your doctors are upfront with you, they should be recommending that you do continue with your follow-ups. At least with an oncologist, it's likely to be at least 5 years. Doesn't mean that the cancer's coming back. It doesn't mean that you really even have to think about it. But chances are you will, and that's perfectly normal to think about it. And once you get past those 5 years, you should get passed on to your primary care doctor with a recommended list of follow-ups for your primary care doctor to follow up in the event of any late developing side effects. Those ones that they talk about before your treatments, this could happen, this could happen, this could happen. Unfortunately, there's no real statistics on who will develop these late side effects. Some do, some don't. I'm unfortunately one who has had to deal with late side effects from my radiation and from my chemotherapy. But through my 35 years of remission, I would say that I've lived a new normal. Now, that normal does include seeing doctors. And I'm not really upset about that because I don't think about relapsing. I don't think about shoes dropping or, what some refer to as the sword of Damocles. You'll have to research that. It's too complicated for me to do in a 10-minute video. But basically, the mythology is a man was thinking that being a king wasn't that hard of a job, and the king offered this individual an opportunity to sit on the throne, and as he's sitting on that throne, above him is a sword hanging from the ceiling by a horsetail thread of hair. Of course, never knowing when that sword would drop and strike him dead. That's kind of what's meant by the sword of Damocles in survivorship. Sometimes we face those kinds of issues. We don't know when, we don't know if, or at all. Okay? But basically, to get to that feeling of normal, in my case, I've had to learn to accept that certain things may or may not happen. I accept the fact that I am seeing doctors my entire life since my cancer. Traditionally, I was only seen by my primary care doctor maybe once a year to get a seasonal allergy shot. That was normal. But now my normal, all these years later, is seeing doctors on average twice a year, every 6 months. And it's no big deal. My appointments normally go without an issue. If something does come up, it gets dealt with. It's just that's my normal. Now, is it all medical? No, absolutely not. Normal still, became impacted by jobs and job changes. I got married twice, divorced twice. I have two daughters that I've watched grow up. My life changes depending on their needs and what they need from me. So my new normal is being more flexible with what may be asked of me. Um, you know, it, I don't, my normal for me is that I'm a lot more cerebral when it comes to challenges that I face. I put a lot more thought into things. That's a normal thing for me now. But, I think, like I said in the beginning, when you're thinking of when will life get back to normal, um, I think that that's probably what a lot of cancer patients are referring to. When do they get to stop seeing doctors? That's when life is really considered normal for them. And then that's what will prompt long term survivors like myself to tell you you're going to have a new normal. And it's not a bad thing at all. I will tell you that, I've had my struggles during these 35 years in remission, okay? But I wouldn't trade any step of the way because I'm here today because of everything that happened. And, I would consider my life normal. This is exactly what it needed to be. I accepted the things that, came my way, good or bad or indifferent. And because of that ability to accept, that allows me to have lived a normal survivorship. Anyway, if you are a newly diagnosed cancer patient going through treatments, finished with your treatments, in remission, in your survivorship, no matter if it's 1 year, 5 year, 10 years, 30 years, 40 years, or 50 years, I want to wish you all a happy Cancer Survivors Month. And we'll see you next time on Paul's Heart.